Hey everyone, it's Dr. Dave with Unlimited Medical Centers, and admittedly, I'm on a little bit of a video making kick right now because I've got a little bit of time, and so why not make another video to talk about a certain point of interest? So this is whether it's from an occupational health and medicine point of view or just a walk-in patient point of view. And we're going to talk about carpal tunnel syndrome. Now, I'm not going to be talking about how we come to that diagnosis and what all of the treatments are, but I did want to tell you about one treatment which I think people underestimate how valuable it can be, and that's wrist splints, and specifically wrist splints at night. So oftentimes with carpal tunnel syndrome, it's thought that there's a multifactorial component that can do with maybe genetic predispositions. We see it more commonly in certain groups of individuals. It can also be somewhat related to repetitive movements of the hands, and then some anatomic variants. Either way, you get an ache in the front of the wrist. It can go in and involve the front aspect of the thumb and the second and the third finger. And it can be quite uncomfortable. And one of the easiest interventions that has really zero side effects is wearing wrist splints at night. The reason for that is simple. If you think that this has become strained for whatever reason, we want to keep it in a position of safety where it's not flexed forward and it's not stressed because you have a lot of tendon movement. Okay. Now, if we're not working and we're sleeping, well, checkbox, we're not having a lot of finger movement, hopefully. But the next thing we've got to realize is that for all we know, I'm sleeping like this on my wrist, or it's tucked up under. And so because of how my wrist is at night when I'm not aware of it, I am at a higher risk potentially to get an exacerbation or these symptoms during the daytime. And so one of the things that we'll do is we'll say, I want to get you in wrist splints at night when you're sleeping. And people will roll their eyes at me. But the reason for that is that if we can keep that wrist, it's not straight, it's actually bent back a little bit with a nice open space for 6 to 8 hours, so a quarter to 33% of your day, you'd be amazed how many people come back within a week or two and they're like, hot diggity, that made a bit of a difference. Maybe not a major difference, but enough to say, I'm going to keep doing it. And I have people that once their carpal tunnel syndrome settles down, they will continue to wear their wrist splints at night. That's their choice. Or if they start to get the symptoms again, they know if I just get my wrist splints on at night, and maybe I'm doing a little bit of icing, Tylenol, Advil, maybe a little bit of physio or some exercises that I've learned, it doesn't get as bad as it was. So that's all I wanted to talk about, that there are things that we can do, even when we're not aware of them, that can set us back during the day. And so for something like carpal tunnel and wrist splints, please believe me when I say that there can be a benefit to even wearing them at night.